wants people to get vaccinated now. But here's the thing, fewer people are getting those shots. Something like 23% of adults got a COVID shot last year, that according to the CDC, even though these shots slash your risk of going to the hospital. Last year, 95% of people who went to the hospital for COVID did not get the most updated shots. So Dr. Mandy Cohen is our newsmaker tonight. She is the director of the CDC, and we're lucky and fortunate to have you in studio with us. So in the CDC's new outlook on this year's respiratory illness season, more than 80% of experts suggested that peak hospitalization levels will be similar or lower to last year. So what is that based on? And does that suggest that we're doing pretty well in terms of vaccinating?
Well, look, even if we have a similar season to last year, that means 800,000 people going to the hospital with COVID, flu, RSV, and we have vaccines that can defend against them. So we want to make sure we're getting out the word. Right now is a great time to get that updated flu shot, updated COVID shot, particularly if you're over 65.
What about vaccinating kids? And we know measles cases have exploded so far this year, right?
So, of course, we want to get our kiddos vaccinated, and it's really important to do that. My kids who are 10 and 12 will be getting their updated COVID shot, their updated flu shot. They're up to date on their routine vaccines as well. Vaccines are our best defense against these viruses.
So a lot of parents are going to say, can I do both shots at once? Not only for me, flu and COVID, but also for the kids.
Absolutely. You can do it all in one appointment. You can do COVID and flu. I do them in different arms, but yes, you can do them in one day.
Do you feel, some people say they feel rotten after one of those shots. Do you get a double case or a double shot of rotten in that case?
Look, it's protection for the rest of the season. So one and done. Take a little Tylenol or Advil and just make sure that you're getting the best defense you can for you and your family.
Are you still facing significant public skepticism about the COVID vaccine? Is that still a PR battle that you feel like you're kind of trying to win?
Well, we definitely want to see more families take up the updated COVID vaccines, of course, get their flu shot, particularly if they're over 65. It's why we are focused on getting that word out. We know not only has the virus been changing, but we know our defenses decrease over time.
Yeah.
And we all don't want long COVID. And anyone could get long COVID. Even if you get a mild case of COVID, it could last for months. No one wants to be sick for a long time. So get that updated vaccine. It protects you. It protects those around you.
I'm just going to add a little bit quick follow to that, long COVID. I've got a dear friend who's had it since January of 2020. One of the first cases of long COVID. He is still sick as a dog, lives in Denver.
Yeah.
Is there any success at all in finding a good treatment for long COVID? Because there are a lot of people out there who suffer from it.
Well, we're investing millions of dollars in research to better understand this. Our partners at the NIH are doing really incredible work. But I want to get back to prevention going forward, right? The thing we know works is preventing long COVID in the first place because we don't have great treatment. And we're still learning a lot more about how long COVID is caused, what we can do about it. So don't go there, right? Get your vaccine now and prevent it in the first place.
Okay, so if you got your last booster last season, whatever, November, December, January, do you need the new one? In other words, is COVID changing so much that you got to stay on top of it with a new vaccine?
Yeah, actually, COVID is changing faster than the flu virus.
Really?
Yes. And if you ask me head to head, which is still causing more disease in this country, COVID or flu, it's still COVID, right? So if you were a person who used to get your your flu shot every year, add that COVID shot. You want to protect yourself as well. So if you're an employer out there that hosts a flu shot clinic, add COVID. You can get them both on the same day, different arms, one day, and you're set for the season.
So there's a study out there, pardon me as I glance at my notes here, that only 1 in 5 Americans are worried that somebody in their family might catch COVID, and there's decreasing interest in getting that shot. So does that impact how much of a hard sell that you've got, and how do you overcome that skepticism?
Well, we're trying to remind folks that the virus is still here. It caused 800,000 hospitalizations between COVID, flu, and RSV. If we use those vaccines, we're going to defend ourselves against the worst of it. But it's really important for our seniors. If you are over 65, make a plan now, September, October, get that updated flu shot, the updated COVID vaccine, and add RSV if you're over 75 as well.
In an interview you did with us earlier this year, we talked about the CDC trying to regain trust with the public in general, and you said that you you identified transparency and improved communication as two major issues you said that needed to change to rebuild that faith and that trust in the CDC. So a year later, can you specifically identify what you've now done as the director of the CDC coming out of COVID and all of the backlash, whether it was warranted or not, what you've done to try to rebuild that trust?
Yeah, a few really concrete things. One, I think we are communicating very differently. We're quicker, we're faster, it's simple, common sense solutions. We've completely changed what our cdc.gov looks like, so I hope you've noticed that. Second, we're really focused on results, making sure that we're delivering for folks. And when public health is working, it's often invisible. So we're trying to make the invisible visible to folks. And of course, that we are focused on building partnerships and translating that science into action really quickly.
When you say transparency, if you had to take I'm sure you've done tried to take many lessons out of COVID, but would that be, here's what we know, here's what we don't know, and guess what, next week it may change?
Absolutely, and I think hopefully you're seeing that as we respond to other viruses, whether that's avian flu or Mpox. We're trying to be clear, this is what we know today, this is how we're trying to learn more, and we'll come back and answer more questions as we know them.
All right, well, let's pick it up right there. Let's talk about bird flu or avian flu, because in May, New York Times interview, you said that the overall risk continues to be low and that we're not in a place of an emergency. But then just last week, a second health worker in Missouri tested positive for H5N1, and that raises new concern of a potential first ever human-to-human transmission of this disease that has about a 50% mortality rate, right? So the CDC originally called this Missouri case a one-off. Is the agency being transparent about this risk right now?
Well, let me correct you right off the bat. So there's only been one case of avian flu in Missouri. That second case you were talking about, healthcare worker, they were negative. There was a close contact, but they were negative. So only one case of avian flu so far. Again, what do I know today?
Good.
Is one case here. But and we do continue to see the risk being low. So far, the cases of avian flu that we've seen this year have all been mild. We're watching the virus very closely. We're taking it very seriously because we know these viruses could change. So today, the risk is low. We're going to continue to watch this and make sure that these viruses don't change. We have to stay vigilant, but that's why we need to make sure we're investing in public health to stay ahead of the virus.
Can we quickly talk about the impact that climate change is having in terms of more mosquito-borne type illnesses, right? We saw that really kind of upend life in New England this summer. We just learned that it killed somebody today in New York. What is the CDC doing to try to prepare the country for that?
Well, what we're seeing this year related to mosquito disease is actually up and down. Actually, less West Nile this year, more dengue, EEE, which you were talking about in New England, is incredibly rare, about the same as we've seen it in past years. So it's up and down, but you're right in terms of that the summers are longer, which means more mosquitoes are living for longer, more hurricanes and more standing water.
Hotter and wetter.
Exactly. So we know how to protect ourselves from mosquitoes, right? It's use bug spray, long sleeves and long pants when you can. Make sure you're getting rid of standing water on your property, spraying for mosquitoes. So we know what to do. We need to protect ourselves, but it is longer seasons for mosquitoes.
And even Dr. Fauci was victimized by West Nile. It is serious.
He got very ill. I've been in contact with him. He's getting better, but it's a long process. So we don't want anyone to get sick. Make sure you're protected.